Hey everybody, I'm back and I'm live. Hold on 1 second while I make sure we're streaming everywhere else and we'll be set to go. Come on, come on. All right, it looks like Instagram is ready. Let's try this. One more spot, guys. I'm just trying to get it live everywhere. All right. Looks like the smoothie shred dilemma continues. One moment while I move it over there for the smoothie shredders. There we go. 1 second. All right. Okay, so we are now live everywhere. Hi everyone, it's Dr. Brooke Goldner from Goodbye Lupus. It's been a moment since you've seen me live. I hope while I've been on vacation, you've still enjoyed the content that we've been putting up every day. I made sure to still post things for you daily, but as far as the Wellness Wednesdays, I gave you some favorite replays that people really liked in the past, and I hope that that helped you out and you didn't miss me too much. I'm here as I usually am on Wednesdays. It's public service to be here for you, to help you in every way I can, to be healthier, to be happier, to live better. And I'm glad to be back. I missed going live with all of you. And I hope that while I was gone, you did watch my online classes. I kept them free while I was away. So I hope all of you were able to watch and learn and we're able to get a lot of your questions answered that way as well. As I must always say, this doesn't substitute for medical advice. Can't be your doctor over a live video where I can't even see you. So there might be some things that I might not be able to answer for you, but I will try to answer everything I can to the best of my ability to make sure that you understand how to be better at taking care of yourself mentally and physically. I do like to do some teaching. Some of you, if you saw me on the morning news this morning, especially if you're local in Houston, I was there early this morning talking about Men's Health Awareness Month. Why do we need a Men's Health Awareness Month? Why is that? Well, the biggest reason is men, according to studies, and maybe you know a man, I know it's been my experience as well. They often do not prioritize health. They often don't talk about their health. Now, there's exceptions. I've definitely had a lot of clients who are men who are the key person who's doing the research in their family, who found me, who's looking after health. But across the board, so it's not the case. So, for example, Cleveland Clinic they polled over 500 men in their area, and they asked them whether or not they go to the doctor, whether or not they get health exams, all of that good stuff. And what they found is over 50% of the men they polled said they don't talk about health at all. Over 50%. That 40% admitted they'd only go to the doctor if something was really, really bad. And so for a lot of men, they end up passing away from things that could have been treated had they gone sooner. When I was in the green room getting ready to go on the news earlier, they have a green room for those of us who are the guests that are going to be on that day. And so we always chat amongst ourselves. What are you going to talk about? All that good stuff. And one of the ladies I was talking to, she said, oh my gosh, my father, I can't get him to go to the doctor. I finally got him to the doctor recently because he stopped being able to walk and he still didn't go to the doctor. And she finally took him to the doctor and he said, 3 more days, you would have lost your foot. But yes, I can still help you. And she said, see, Dad, what are you doing? Right? And maybe you know someone like that in your life. And so the reason for Men's Health Awareness Month is really to raise awareness that men do need to talk about health. They do need to go in and get their checkups done and find out how their health is doing. That you don't want to wait until you can't walk or you're clutching your chest to see a doctor. You want to find out what's going on. And one of the key reasons men will say that they don't go to the doctor, this is what that lady I was telling you about, what her father said is, They're so afraid they're going to hear something bad, as if hearing it from the doctor somehow made it true rather than the fact that it already existed. And so I think a lot of times people are afraid to hear it because they're also afraid to be given medications and need treatments, right? But knowledge is power. I didn't make that up, but it's true, right? If you go and get your annual exam and labs done and you find out your cholesterol's high, or you find out that your blood sugar's been high, yes, you might be told by your doctor that they recommend that you take a medication, sure, but you don't necessarily have to do that. Now that you have the information, you could also see someone like me. And you can instead decide, you know what, I'm going to start exercising. I'm going to change my diet so I can bring my cholesterol down, bring my sugars down. One of the biggest things I help people with, even though I'm known as Goodbye Lupus and Goodbye Autoimmune Disease, is I help people with metabolic issues, cholesterol, weight, food addiction, high blood pressure, all of those things. That's the most common thing that we see. Most doctors would say it's your bread and butter, but it's the bread and butter that's contributing to these diseases. But I see that all the time, and I can help people overcome these things very rapidly because the same protocol and hypernourishment and all the things that I teach that can reverse devastating incurable diseases, otherwise medically incurable diseases like lupus and rheumatoid arthritis and all that, they quickly eliminate things like high cholesterol, high blood pressure, high blood sugars, obesity. All of those things get better really rapidly doing that as well. But if you don't know the information that you have this issue, well, it lets you continue doing the things that are making you sicker. Number one cause of death in men in Western countries, including US, is heart attack. And heart attacks are almost entirely avoidable. They are primarily a disease of food, primarily. And there's different mechanisms. I talked recently at one of my Wellness Wednesdays before I was on vacation. I was talking a bit about one of the pathways that we know now causes myocardial infarctions or heart attacks that they discovered. It was a really cool study that the buildup of the plaques in the arteries that blocks blood to the heart. So a heart attack is when you have the blood flow is blocked to your heart. And so that area of the heart doesn't get blood flow suddenly. It will die. It'll starve of blood and that tissue will die, because that's our heart's job is it contracts to send blood that's full of oxygen from the lungs through all of our tissues to keep our tissues alive, our whole body alive. Well, the heart itself needs oxygen too. And so there's arteries that feed the heart as well. And so if one of those arteries that feeds the heart gets blocked by just a buildup of plaques in the heart where the blood can't get in, that area of the heart can die, and that's called heart attack. Okay. Now, depending on how much tissue is destroyed and how long it lasts, it can be fatal, or sometimes people can survive them, but that's the cost. And so one of the things that they found out in more modern research of the past decade is that the mediator that tells your body to put the plaque into the artery is something called TMAO. And TMAO is created by bacteria in the gut. And those bacteria in the gut are the ones that thrive when people eat meat. It was a really profound discovery. And what they found is vegans don't have those bacteria. They don't make TMAO. And so therefore, if a vegan trips and falls and they land on a beef stew and some goes down their throat into their belly, what they found is that they don't release TMAO because they don't have those bacteria. Now, that should have gotten rid of heart disease, right? That should have been on every news channel. We found the cause of heart disease. That if you eat meat, you grow these bacteria, they make TMAO, and that tells you to make plaques in your arteries. Stop eating meat, everybody, and we will no longer have heart attacks, and the number one cause of death for men and women will be gone. I never saw that news. And actually, the person who did the study said in his discussion that, people aren't going to change their diet, so maybe we need medications that target TMAO, more medicines. But I'm empowering you with knowledge so you can make that difference. But if you don't know that information, if you don't know you have heart disease, if you haven't gone to the doctor and been told, yes, you have heart disease, you get a stress test done, you have cholesterol tests, you do all the tests, and they say, yes, you have heart disease, you now have power. You can decide, do I want to take the medications? Do I want to change my diet? Do I want to do both? But now you have power instead of just becoming a victim to something that could be unavoidable. Most common cancer in men, prostate cancer. most of the time, prostate cancer isn't deadly. I know former President Biden just was diagnosed with it. And one of the reasons he was diagnosed so late, if people were like, how can he be diagnosed so late? Typically, they stop testing for prostate cancer once a man is over 80 because they figure something else is going to take you out before the prostate cancer, because it's such a slow growing cancer that they typically stop even testing for it as men get older. But is the most common cancer in men. I was taught in medical school that every man who lives long enough will get prostate cancer. Isn't that wild? Now, I've learned different things since medical school. As you all know who follow me, listen to me, I've learned many things beyond my original training about nutrition. And what they found is that the most common dietary link to prostate cancer is dairy. And I've seen this actually in my own practice. I've helped people get their PSA markers down to normal really, really quickly. And recently, even I have someone that I've been working with who her partner was in a family of dairy farmers, and every single man in this family had prostate cancer, every one of them. But when her partner had his numbers go up, she made him eat on my diet, and his next test, his numbers were normal again. Doctor was shocked, right? So I've seen it even in my own work, that we can do something about that, that it's not that every man is destined to get prostate cancer if he lives long enough, but that every man who maybe consumes dairy and other animal products, maybe they are more destined to get prostate cancer. You know, milk is a hormonal thing. It comes from a cow that just gave birth. So it is higher likelihood of those hormones affecting us, women increasing our breast cancer rates, men increasing their prostate cancer rates. That's something we can do something about that. But whether or not you're going to do something about your diet, if you go and get your annual exam, men, and you get your PSA markers tested on a lab, you get the exam by your doctor to make sure there's no lumps or bumps and things. If you stay on top of it, typically it's discovered before it can turn into something metastatic that can spread. If you don't get things tested, by the time you find out, it might be already too late. So I think it's very important that men are aware of these things, that they are aware of the health issues, that they're open about talking about these things, that you get the tests done. And yes, you don't have to go the traditional route. You can if you want to. But if you don't get tests, if you don't change your diet, and if you don't take medications, you're just choosing to be sick. And we need you too much, guys. We need you too much for that. So I do want to bring awareness to this. And, you know, even with talking about men's health, the other part I wanted to bring attention to is also mental health. At least in our society here, Western society, and in many societies, actually, in Eastern societies too, men often are kind of discouraged from expressing mental anguish in the same way that might be more acceptable for a woman. You know, I once won, okay, here's a fun fact I've never shared before. I once won tickets to see, all right, it was Nick Lachey and Jessica Simpson when they were married. All right, I won tickets to that concert. I didn't know who they were when I won them, so I gave them away. It would have been a great concert. I didn't know. I just wanted to win something. I was driving to medical school. I was driving to class, and I heard a contest. This is going somewhere, I promise. I heard a contest on the radio, and I called in, and I won the tickets that I gave away. But the question in the contest was, up until age 12, men and women do this the same amount. But then after age 12, women do it more, and men dramatically lower their rates of doing it. And the answer was, who can guess it? See if any of you write it. The answer was cry. So we are wired genetically to cry the same amount. We feel feelings just as much as each other, but men are taught by societies often to hold it in. And that is why they tend to express things differently. They might be taught that, yes, hi, 987-956, you got it. Yep. So on Instagram. But yeah, if you can't express your sadness, if you can't express your distress, sometimes the only thing you feel safe expressing would be anger, which can sometimes be more destructive, right? That we need to bring awareness that men can and do feel things in the same level as women, that they do also need help, and to be able to talk to people about it, that you are allowed to have all of those feelings. And you also need to get support for them, that none of us can handle everything that happens to us all by ourselves. And it is not weakness to get help. It is strength to be able to lean on each other. So whether it's mental health, physical health, there is so much that can be done to make your life better. And so I wanted to bring attention to men's health issues. This is why, my rapid recovery group, we do a focus every day on emotional health. I am constantly working with people on this because I know that diet alone is not what creates the best health, right? That if you're already mentally extremely healthy and then you just do the aggressive diet, you're going to have really, really rapid results. But if you're stressed, depressed, anxious, angry, traumatized, it's a slower process because those emotions are inflammatory. It's still worth doing because you need the diet to support you. But I really want to help people totally revolutionize the way they treat themselves and the way they feel. And so we're working on that every day. And my husband is my partner in working in the group. And he is a very emotional person too. And he makes it very safe for people to express that as well. But it's such a beautiful thing when the men who do our program come through and are able to say, like, I feel so connected. I feel so happy. I was just reminded yesterday, someone was asking me about glaucoma, and they were reminding me of Bernard, who did a video for me, who is in his late 70s, and he reversed glaucoma, completely reversed his glaucoma and didn't need surgery after 5 weeks in my rapid recovery group. And even reversing his glaucoma and his high blood sugar type 2 diabetes, he still said the best part was, for the first time in his life, he felt happy. Our quality of life is so much more based on our emotional health than our physical health. You can have physical pain and good mental health and still enjoy your life, versus no pain or health issues and poor mental health and feel suffering every day. A lot of the folks I see have both. And so it has always been my greatest drive, really. And something that I really love to do is to help people with all of those things, so that when they leave, especially in my rapid recovery group, by the time they graduate, that they no longer not just have symptoms and health diagnoses or issues, but they enjoy their life again. And that's stuff you can start working on right away. So whether it's mental health, physical health, do what it takes to get better. Have the conversations and get the information. You don't have to be afraid of doctors. I'm used to people saying, they meet with me and they go, I hate doctors. And then I kind of go, thanks. They go, well, not you. Okay. But that you don't have to be afraid of doctors. They work for you. It's okay to go to them, get the information, have the conversations, but not necessarily feel like you have to do, that you're coerced to do anything they say, but to have the conversations about risks and benefits, know what you have, so that you can then make really good decisions. If you keep yourself in the dark, it doesn't make it so you don't get sick. It just makes it so you never see it coming. All right. It's like wearing a blindfold crossing the street. All right. That doesn't stop the cars from coming. It just makes it more likely you get hit and killed. We've got to know the threats that are coming towards us. And when you do that, you have a better chance of dodging them and making sure that you get through to the other side. So, all right, everybody, that's what I wanted to teach you about today. I know some of you have been holding on to questions now for the past couple of weeks while I've been away. Hopefully that hasn't caused too much suffering for all of you, and that you are that you still did some healing work while I was away. All right, let me see. Let me check in on what people are asking about. So we've got all these folks here. Thanks for all joining me back again here. See, Instagram, Facebook, YouTube. Thanks for the welcome back, Evan Fruit. Let's see what Instagram's asking today. Hi, Sonia Ortiz. Hi, Roshizan. Sorry. All right, let me see. Okay, so Gwenzima for Life says, I don't know what lupus really is. Okay, so lupus is what we call an autoimmune disease. So this is a quick version of it. Autoimmune diseases are really when your immune system starts dysfunctioning, okay? So your immune system job is to keep you healthy and safe, right? Your immune system, its job is to make sure, first of all, that you're not under attack. Bacteria, viruses, that they can't get through and destroy you, right? So one part of your immune system's job is to find things that shouldn't be there, tag them, so that another part of your immune system can go and grab them and get rid of them, right? Create antibodies and grab them and get rid of them, right? So we have a set of our immune system that's supposed to be doing that. We also have parts of our immune system that scans through our bloodstream, through our body to look for things like cancer cells and destroy those. There's also parts of our immune system that are supposed to be anti-inflammatory, although you can't create it without anti-inflammatory nutrition like omega-3 fatty acids. But there's a part of your immune system that's supposed to be anti-inflammatory that brings you back to normal after dealing with a threat, like an inflammatory threat, like an infection or an injury, okay? So there's many different parts of our immune system. In autoimmune disease, the part of our immune system that's supposed to kill and destroy bacteria, viruses, etc., gets confused and it starts attacking our own tissue. And so there's different kinds of autoimmune diseases, and they're mostly labeled by which antibodies there are, which areas they attack. So rheumatoid arthritis primarily is attacking joints, and so that would be rheumatoid arthritis. You look for a rheumatoid factor in the blood or CCP antibody, right? If it's multiple sclerosis, it's going to be attacking your nervous system. If it's a central nervous system, if you have scleroderma, we're going to be looking at elasticity in the skin. So there's different types of autoimmune diseases. Lupus can attack anything. And so lupus is considered the most aggressive oftentimes because it can really spread to any of the different organs. Although you can have severe forms of any autoimmune disease, lupus can kind of keep you guessing. So it can be just in the skin, it can be in the joints, but it can also attack your heart, your lungs, your brain, your kidneys. It can attack many things, and it can be very life-threatening. I had lupus for 12 years of my life, and it first attacked my kidneys and my joints and caused rashes, and then I had mini strokes. And so I was very sick and required a lot of medication to survive for 12 years of my life before I changed my diet using what's now known as a Goodbye Lupus protocol. And now I'm 19 years healthy. Actually, October will be 20 years. So I'm going to need all of you guys to give me ideas of what we should do to celebrate 20 years lupus free. I feel like this should be something big, but I don't know what to do. So I'd love to hear your ideas on how to celebrate it. So that's the short version of really what lupus is. And so why lupus is many factors. The dysfunction of your immune system can be caused by many things, usually a combination of high stress, poor sleep, poor diet. All of these different things can trigger autoimmune disease like lupus in people who are genetically more prone to them. But that also means fixing those things can undo it. And that's what I'm known for, is helping people reverse or undo the autoimmune diseases like lupus and get healthy again. So I want everyone to feel as good as I do. All right, let's see here. All right. French greenie, optic neuritis, but got it back. Okay, you got your, I hope you're saying, I don't know if you got the optic neuritis back or you got your health back. I hope you got your health back, because this is my protocol to be very helpful for this. All right. Roshi said, I recently noticed I have yellow hands, but my liver panel is normal. What should I do? I would say that you celebrate that you're well nourished. So it sounds like if you're on my protocol that you're just showing that you have enough beta carotene. So beta carotene is something that's in many things. People mostly know about it in carrots, but it's high levels in greens as well, leafy greens. And so it's very normal if you're very nourished to have your skin develop a more yellow tint or orange tint, depending on your underlying skin color. All right. So mine is more of an orange tint. So you might notice like I usually look like I have a suntan. That's beta carotene. That is just, this is natural suntan. Whereas when I was younger, I had a more pale skin and now I have a natural tan. Some folks with different skin tone, they might look more yellow. And if you have dark skin, sometimes you can't see it like you can on my face, and you might only see it on the bottom of your feet or the palms of your hands. So that's just a sign of good beta carotene intake. And it's actually, I've talked to folks who are in the nutrition world who say that, you know, that's what they hope for, is that they can see that skin color change to know the person's getting nourished enough. So it is nothing to be concerned about. If it's being caused by liver failure, so people with liver failure can turn yellow, but they will turn yellow in their eyes. Okay. It's not, and then they will have other issues with liver failure, you know, other symptoms of liver failure. But if your eyes are still white, see, my eyes are fine, right? Your eyes are still white and it's just there, you're just nourished. There's nothing really to be done there. All right. And Gwen's a mom for life. Symptoms of lupus. So again, that can change. It could be rashes. It could be joint pain. Could start out with fatigue. It could also be early on just fevers that won't go away and no one can figure out why you have the fever. So many different symptoms. And if you feel like that you might have something going on, make sure you ask your doctor to test you for autoimmune panels. Most folks are misdiagnosed or need to go to up to 5 doctors before they get a real diagnosis. But with or without the diagnosis, you can always do my protocol and get rid of those symptoms. All right. Oh, Frenchie Green says, I got rid of my MS. All right, goodbye, MS. Yay. Oh, I'm so happy. I love to see people come on and celebrate. Goodbye, MS. Oh, wonderful, wonderful news. That makes me so happy to see that. Awesome. All right, let's see here. Okay. Oh, and for more data on the person who asked about, there's a follow-up on the yellow hands person. It happened after drinking a ton of kale smoothies. My liver panel is normal. I have PKD, but my GFR is greater than 120. So there you can see your kidneys are perfect, your liver is perfect, and you're nourished, and that's why you have a change in your skin color is perfectly fine. Let me see here. Okay, let's go over and see what folks on YouTube are asking about. Let me see. Diane Wilhelm wants to know, my husband loves your smoothies, but hates raw veggies and guacamole. He is in need of from MS. Is there any hope for him if he tries the rapid recovery group? Yeah, of course. So first of all, if he likes the smoothies, it's okay if he just does smoothies. If he doesn't like guacamole or doesn't like raw veggies and guac, there's so many different ways to do this. So the most important thing is that the on-protocol foods get through this hole in the face by the end of the day, okay? It does not matter if it's blended, if you chew it, if it's dipped in guac, if you do instead, one of the recipes. So goodbye lupus, hello delicious. My recipe book, let me see, it's opposite here. So the one where I have the chef hat, all of those recipes are raw and they are not veggies dipped in guac. There's so many. We do have a good guacamole recipe in there, a couple of them, but there's so many different kinds. There's some folks who are healing just going crazy on the cauliflower popcorn recipe. All right, it's called the buttered popcorn dip. I have folks who put that stuff on everything, right? So if you can find one dressing you like, you can eat unlimited veggies, right? That's it. So we have so many dressing recipes in there. So if he wants to munch and crunch, I would say open up that book and just try some recipes until you find something he likes. If he wants to do the smoothie thing until he's better, he can do that too. He could always do the smoothies and then eat vegetables he likes raw because he's already got his hypernourishment in from the smoothies. So there's so many ways to do it, and it's okay if he prefers the smoothies. He doesn't have to eat guacamole to get better. The rapid recovery group, yeah, in the group we will personalize approach based off someone's issues, right? So you have to be willing to listen and try. All right, that's the most important thing. I have someone who started a page against me because she joined my group and then said in the first meeting, I will not try any of the recipes. I'd rather starve than eat raw vegetables. And then didn't eat raw vegetables and then left and then now says the protocol hurt her, but she never was on the protocol. People do some stuff, right? So blame me, fine. Taylor Swift, I'm the problem, it's me, right? But if you're not willing to eat raw vegetables, if you're not willing to try the recipes I give you, then don't do it because you need to consume the vegetables. But if you're open to say like, okay, I'm willing to get it in some way or another, and I'm willing to try different things, we will continue to work with you to help you figure out how to do it. So it might be that we stick with mostly smoothies. And then if you want to crunch and munch, we find other things. Maybe you want to eat flax crackers or something else. It's fine, right? If you want a salad, maybe we come up with some other ideas. Maybe he likes the buttered popcorn dip. Maybe he likes the asparagus pesto. So as long as you're open to continuing to try the things we're telling you to do, then you're going to get the result. And most often the issue is people having, a sensitivity or a food, aversion of some kind or something like that, where we're like, okay, we have to, let's take this out. Let's try this. So we will help people every single day. We have unlimited ability for people to ask for help and support in the group, unlimited. On a daily basis, they can write back and forth with us unlimited amounts. And then we have live coaching once a week as well, where they can come on and let us talk them through issues that maybe they need extra help on. So yes, number one, he has to be open to getting the food in some way, which it sounds like he is. And the reason to do the group would be really, I mean, if he's willing to do it all on his own, there's no reason to do the group. But if he needs the help and you're like, I'm maxed out on how to help you, and he's willing to work with us every day and let us know what's wrong and let us give him advice, yes, it's the fast track, because we don't let things keep going. You know, we're able to say, hey, did that work? If that worked, great. If that didn't work, let's try this today. And we've seen so many things because we've had over 1,000 people do that program. So most of the time, there's nothing new. We're like, oh, yes, the last person who had that same aversion totally did well with this. And so, yeah. The next group is August 22nd. We are currently half full. I expect it to start speeding up, though, because those groups always fill up, and we didn't do an over the summer group. So typically they fill up 2 weeks before, within 1 to 2 weeks before, but when we've had a gap, sometimes faster. So if you know you want to do it and you're open to coaching, okay, I don't want anyone spending money on the group who's not ready to just follow along and let me help you. All right. It's so important. If you know you're not in a place where you're really ready to go all in and follow and do the things that I tell you to do, you're not ready yet, that's okay. You can always do an appointment with Thomas or me, or work on it on your own till you feel ready. But if you're ready to go all in, it's the fast track, and it's awesome, and we'd love to do it. So that's goodbyelupus.com. You can click work with Dr. G and check that out. All right, let me see. Let me see. Okay. Anna says, I'm on the rapid recovery program for 5 weeks now for uveitis from an eye infection a year ago. Inflammation returned after stopping my steroid drops. I want to stay off them. All lifestyle issues, great. Any tips? Okay, first of all, rapid recovery has not been going on for the past 5 weeks. So you're not in a, so rapid recovery program is a program that you're doing with Thomas and or me, overseeing you every single day to make sure you're doing everything right in your diet and lifestyle. So I'm very specific. Like, you don't want to say you're in rapid recovery when you're not. But it sounds like you're trying to do the Goodbye Autoimmune protocol, right? So everything from my book, Goodbye Autoimmune, where you're doing your diet, your exercise, lifestyle. So if you're doing that, that's awesome. When it comes to inflammation coming off steroids, it could be one of two things, I'd say. One is you weren't quite done healing yet. The others would be rebound inflammation from stopping steroids too quickly. So the side effect of really any medication, including steroids, is the opposite of what it does. So if you are on a steroid, which suppresses your immune response, and then you suddenly stop it, you will get rebound inflammation as your body has to try to recover and figure out how to make its own steroid to replace what it was getting before. So it might have been that you needed to do more of a taper. Now, I can't tell you how to do that. I'm not an eye doctor that can tell you how to do a steroid taper. So you'll need to talk to your doctor to see, is this something where you can continue on with what you're doing for your diet and lifestyle and see if it comes back down again, if it's a blip, or if it's come back for a while now and it's staying up, whether you need to use them again and then taper more slowly. Because that can happen. I had someone who did my rapid recovery group for lupus in her lungs. She actually did my first group. I'll never forget it. So she had lupus that was in her lungs. It's called pleurisy. And every time lupus would end up in her lungs, she'd end up in the ICU. And she was, trying to go to school, become a lawyer. She had all these big dreams, and lupus was taking her dreams from her. Maybe you can relate to that. And so I had said, I'm going to do this. I'm going to try doing this rapid recovery group. And she decided to join. She actually had just gotten out of the ICU and she joined. And the inflammation disappeared from her lungs completely. And she went from laying on the couch to jogging every day, went back to school, became a lawyer. Awesome, right? All these good things. But when they tried to taper her off her steroids after she had had her recovery and was doing really well, she got some lung pain back. And the first thing her doctor said is, the lupus is back. And I was like, I don't think so, because I saw her labs and the lupus was quiet. The lupus antibodies were not active. And I said, it sounds like they tapered your steroids too quickly. Talk to your doctor about that. So to a back to your doctor, they agreed her lupus antibodies are negative. They restarted the steroids and then just tapered her more slowly. And immediately the pain went away. She was able to get off the steroids completely and did not relapse after that. And so then they were able to say, oh, the pain you had nothing to do with lupus. It was that we did the steroid taper too quickly, and that caused the pain. So it is just one of those things. It's the same thing with anything. Even people who take ibuprofen every day. There's some people who get daily headaches and then they start taking ibuprofen every day, and then they can't get off ibuprofen because if they don't take it, they get a headache, not from the original reason, but from ibuprofen withdrawal. So it's one of those things. And that's something you're gonna have to see your doctor about. Since I'm not working with you, I have no idea how effectively you're doing the program on your own, what the other issues are that's going on. So that's the best general answer I can give you. All right. Okay. Let's see. Okay. Sue Hassini, what tests should be done for checking Sjogren's markers at what intervals? So when it comes to Sjogren's, which is also autoimmune, but it affects your glands that will provide moisture, like in your eyes, your nose, your mouth, even vaginally, people can get very, very, very dry and painful and get itchy scalp and things. So we've helped people reverse Sjogren's, and most important is symptoms all the way. That's the most important thing you want to check for. If your symptoms are better and you want to see how your markers are doing, I would say probably I would test more than 6 weeks of the most aggressive program. Like my group, people will test it 6 weeks out because they're trying to see, before and afters of rapid recovery. But typically 2 months max. Antibodies need to die off for those numbers to change. And with Sjogren's antibodies, they often will measure them as greater than 8. So oftentimes people will say, oh, they have Sjogren's and they have SSA and SSB antibodies, and it says greater than 8. And sometimes you can check 2 months later and it still says greater than 8. And then people will go, oh, there's been no change. And I have to say, of course there's been change, but you can't see it because greater than 8 could be 200 and it could be 9. You're not going to see the change until it's less than 8. So it's one of those things where primarily the symptom is the most important thing. I've seen people reverse both of those markers, SSA, SSB, and have them both negative. I've also seen a group of people where SSB is negative and SSA still stays greater than 8, but all symptoms gone off all meds. So SSA seems like one that can kind of stay around, sometimes like an old vaccination kind of situation, but symptoms are the primary thing. But I wouldn't test more than 2 months for those. But there are other tests you can look at. ANA, you can look at your complement markers, C3, C4, which tell you how active your immune system is. Those things can help a lot too. All right. All right. Let's see here. All right, so let's see. So AR is panicking here. Let's see if I can help you out. All right, so just been hypernourishing for months, added iodine because I had a high TSH and TPO. Now TSH is 15.7. My TPO is 158. It was higher than January. T3 and T4 are normal. Now I'm starting the Goodbye Lupus protocol, but I'm scared to supplement iodine again because I'm scared that iodine was what caused it to get that high, because I was only hypernourishing. So that should not be the case. If you had a high TSH, then the iodine should not be the issue. One of the ways that you might be able to get the answer, so I'm not sure what's causing it. Since you were just hypernourishing, it could have been something else in your diet. It could be bad supplement. Maybe the supplement wasn't effective. I've seen it before where someone got a supplement that didn't work. So one of the ways you can find out what's going on is you can test for iodine. They can test blood and urine levels. You'll have to look at the test to find out how long you have to stop supplementing before you can get the test done. Because if you took the supplement and then get the test done, it's going to be in your system. So you can get that level tested, but you do need to have iodine intake for your thyroid and your brain function, especially on the GLP. So if fear is a big part of what you're going through right now, I would get data so you don't have to be afraid. I do not think, because 300 micrograms a day is the right amount for someone with hypothyroid. Now, I haven't seen your labs, so I don't know if everything's being interpreted correctly. And that's an important thing too. Having done the work that I do for all these years, I know how to interpret the labs. And it's not always interpreted in the same way as you would interpret for someone who's just getting sicker as usual. And a lot of times when people look up what things mean online, they also get more scared. So I'd have to look at all of the labs too to be able to interpret that correctly. And it's not just, I'm not just saying that about you. I do this for my doctors too. I just saw a doctor this week who's done rapid recovery with me, and she needed me to look at her labs because she thought she hadn't gotten better. And then I was able to show her, look, your antibodies, look at this. Like, this is great. This is so much better. And she was like, oh my God, I didn't even understand that. I forgot about that. Like, so most people have struggled with that. So sometimes things aren't worse. But if your TSH is really climbing, and 15.7 is pretty high, usually with someone the TSH that high should be on medication to supplement their thyroid hormone. So if you suddenly stop medication, that could be related to it. I just don't know enough of your history to be able to tell you what happened. But typically you would need iodine with the TSH that high. I think what you're thinking about is sometimes you can overdose on iodine and damage the thyroid, but usually that amounts people are taking are much higher. I've seen scary amounts before where people are following people that think you're supposed to hyperdose iodine, and that could damage your thyroid. But following those guidelines are not hyperdosing. So don't be afraid. Get information. If you need me to look you over, you can always make an appointment and I can read it over and learn your history and be able to be more specific to you. But don't worry, okay? There's a path through always. And if you need to take thyroid hormone for now to get yourself stable, then do that so that your body gets what it needs, because your thyroid is the battery pack of your body. You do need to have iodine for it to work properly. All right, let's move down here and see what's going on in the Facebook world. All right. All right, Mary Steinborn, it's good to see you today. Thank you, Mary. A friend of mine was just diagnosed with amyloidosis stage 4 and cardiac amyloidosis stage 3A. She just started chemo. Have you worked with anyone with success with AL or cardiac amyloidosis? I remember you mentioning a case of someone who had already had the heart transplant and healed from kidney amyloidosis on the protocol. Yes, and that was exactly what I was going to bring up. So it was already too late because the heart was gone and replaced, but the kidney was able to heal. And he was like, man, if only I'd found you before the heart surgery. But we were just happy to get him well. So we do know it works well for amyloid. I don't have another case where we got to the heart in time, but she can be the one, right? So I definitely recommend she do the full protocol. No other tweaks to the full protocol besides if she had issues with it or being on it. Okay. All right, let's see here. Okay, Wendy Ramirez, hi Wendy, says, hello, Dr. Goldner. I began hypernourishing to ease into my goodbye autoimmune protocol next week, suffering from long COVID, POTS, ME/CFS, asthma, GERD, post-COVID. Yep, I know that whole grouping, that post-COVID grouping. I totally have seen that many times before. I'm sorry you're suffering with that, Wendy. I'm plant-based for 8 years, but not raw. Anywho, I'm reading that. Anywho, the GERD has gotten a bit worse with hypernourishing. I am doing my water. Could it be too much chia flax? Could cutting back a bit help? I'm not doing about 75% raw with a warm plant-based meal for dinner. Already lost 4 pounds 1 week, and I feel I'm eating more. Thank you. So if the only issue is just the GERD is worse, listen, that's going to be your stomach adjusting and also pressure from your stomach pushing up into your esophagus. So how would you deal with that? One is, yeah, if you want to decrease the bulk of food going through, you could take the seeds out and just do flax oil instead. Do a few tablespoons of flax oil. That'll dramatically decrease how much food's going through your body, because flax and chia seeds, a half a cup starts out small, but then you add all that water you're drinking and everything, and you've seen how they plump up and expand and gel up, right? So if you want things to move through yourself easily, try doing that. Also, food spacing. Try not to put too much in your stomach at once. If you're overly full, that puts more pressure on the esophagus, and that can make you have more reflux. So you can also try food spacing, like the same size meal every 2 hours to give your stomach time to empty, because your stomach usually empties about every 2 hours, and that might actually do the trick for you as well. All right. Hi, we celebrate eating plants. Hi, Karen Hepner. Good to see you here. All right. All right. Diana Trinia says, soaked walnuts on Goodbye Autoimmune protocol. Are they really not allowed at all? Not even a couple halves? I adore them, and it seems I'm addicted to eating them with chocolate bites. The best dessert. Thanks for all you do for us. Sounds delicious. You got to decide what you want to do here. You're trying to get me to condone your chocolate walnut habit? I would say, can you get away with them? Perhaps. Is it part of the protocol? No. Are you increasing your chance that it might not work effectively for you? Yes. So the chocolate part is also problematic here, unless you're talking about just the raw cacao. But I would just take them out and get your results. If you're on the Goodbye Autoimmune protocol, it means you're trying to get rid of something serious. So let's get serious. Get rid of it and enjoy an on-plan dessert from my recipe book, all right? And then get well, and then add all walnuts back, and you can have them for the rest of your days after that once you're well, okay, Diane? All right, let me see. All right. Okay, let's see here. Oh, goodness, look at all these questions. I'm trying to make sure that we don't have any repeats. Oh, I found a celebration. Yay! Always happy when I see people celebrate. I think that's one of the most important things you guys can do here is celebrate with each other. So important. So celebration, no more migraines on your protocol, Dr. G, and my anti-TPO is almost normal. Thank you, Dr. G and Thomas. So right here, we're looking at migraines and Hashimoto. So TPO antibodies are associated with Hashimoto. It's one of the most common things I help people reverse because it's one of the most common autoimmune diseases is Hashimoto. So congratulations. I'm so happy for you. That's super, super cool. All right, let's see here. Fran wants to know, rapid recovery, what times PST versus ESD do you meet? So the live meetings that you want to get to for being able to talk back and forth would be 9 a.m. Pacific time, which is noon Eastern time. The rest of the daily stuff, we do writing back and forth at your own time. So that makes it very, very easy for most people to do. And we do record the live meetings if people can't attend them live. Okay, let's see here. All right. So some of the comments are funny. Sorry, I'll read to you in a second. Let me make sure I got my smoothie shredders going okay here. All right. All right. Okay, so Sway Buckley wants to know, thank you for all your help. I've been doing the Goodbye Autoimmune protocol. One lab, my ANAs are already negative. Yay, but another location, it showed one last positive, 1 to 320. Question, when should I start my step down and cook foods again? Does it normally take this long for ANAs to die off? You can, if you don't have any symptoms, then you can do step down. Sometimes the ANA can take time. It's interesting. There's people who it's already negative in the first month. And then there's others where they do step down. And then like a year later, that finally goes into the negative range. But if it's the only thing left and you're otherwise asymptomatic, I don't see a reason why you can't do step down. I don't think you need to continue on with it that way. Okay, that's the only one there. So, okay, the one that made me smile there was Charlotte. Hi, Dr. G, you are Superman without a kryptonite. For us mere mortals, how do we overcome monthly cravings? Can you give us strategies and talk about that? And does Goodbye Autoimmune help someone with Graves' disease? So first of all, it's not that I am superhuman and don't have any kryptonite. I am a human like every one of you, and I have worked on myself, okay? And you can work on yourself too, and we can all get better, right? So it's not that I'm superhuman. But if you're talking about monthly cravings from menstrual cycle, there's different ways that you can handle it. So number one is you can try to replace, if you're looking for a food replacement, then use a food replacement, but use it from something safe. So for example, in Goodbye Lupus, Hello Delicious, we have a whole dessert section between the popsicles and the pies and the candy bites and all that stuff. those are all raw, they're all on plan, and you can have them and just tell your brain, hey, chocolate is chocolate, and enjoy them. If you're a salt fanatic, go for some of the salt recipes, the buttered popcorn, the pesto, the kale chips, the flaxseed crackers. There's ways that you can handle that. But if you're looking for something where you really just need to feel better because you're grumpy and don't feel well, I'd be looking at self-care. Maybe that's the day that you go for a massage or a facial so that you can feel really good and taken care of rather than look for food to make it better. So that would be a really great choice to say, you know what, it's my time of the month. I really need to do something special for myself to feel extra good and not just eat something to try to hit the dopamine button in my brain. That's what I'd say. And yes, absolutely, we've helped people quickly reverse Graves' disease. Yes, we have, especially in our rapid recovery group. All right. Colette says, I've often heard functional medicine practitioners insist on the importance of taking magnesium supplements. Does that apply to women who are plant-based? You know, it's important to understand functional medicine, it's not that they're given any extra training in really nutrition the way I'm teaching you. They're really just more trained in supplements. And so what many of you might have found is you go to a functional medicine doctor, and then they give you a bunch of supplements to take instead of a bunch of medicines to take. But it doesn't necessarily solve everything. I've heard some great advice from functional medicine doctors about diet, and I've heard some terrible advice. Depends on who they follow and, you know, where they get their information from. But I have not found that everyone has to take magnesium. I don't take magnesium, but I do sometimes encourage people to take it depending on what's going on with them. Magnesium oxide can sometimes help with migraines. Magnesium citrate can help with people who have chronic constipation, who have been dependent on laxatives or have a slow bowel for different reasons that pulls water through. It can help with sleep. And it can help some people who have muscle cramps. So there's reasons why I would use it, but I don't across the board recommend it. The only things I across the board recommend are the things that everybody truly needs. And I found that in my practice, not just from reading it somewhere, that they need to take B12, vitamin D, iodine. Those are ones that across the board, again, through practice and results, not just I read this somewhere, hope it's true. Those are the ones that people truly need to take every day. The other ones, I just go person by person to see if that's something that they require. Renelle Quarashi, hello from New Zealand from a newly diagnosed lupus girly. All right, well, let's newly diagnosed to quickly undiagnosed, okay? Let's keep you coming to these Wellness Wednesdays, get you going on the Goodbye Lupus protocol and well again soon, okay? K-plant lifestyle. How do you answer people when they say high cholesterol is normal and healthy? This seems to be a fad. I think you might have to let go of having an answer for everyone with incorrect information. I mean, if I wanted to correct misinformation, I would, like all of it that I'm confronted with on a daily basis, I would never leave this chair. And sometimes I feel like I already never leave this chair. So it's just not possible, and it's not necessary. All right. If someone comes to you and says, hey, I'm really interested in learning about cholesterol, what have you learned about it? Great. Or if someone says, I read high cholesterol is good, and you say, are you interested in learning maybe other information that might not agree with that? Are you open? Then great. But if they're in your face, I'm right, let them live. All right. You can't fix everything. I get text messages all the time from people, all the time, saying, hey, this doctor just said online that you tell people to have too much flax seeds, or this doctor just said that you need to have a more diverse diet than this. What do you say? And my answer is always the same. I don't actually have any response for any other doctor's thoughts or opinions. All I care about is results. And whenever I have, I've stopped at this point, but whenever I have, especially if it's someone that I know, respect, I click on it. Every time they're saying that, they're like, I think it is too much because it possibly could do this. It potentially might be that. And as soon as someone says, I think possibly, potentially, they're making it up. It's not based off results. So it doesn't matter. So I just I'm not going to do that unless, so every once in a while someone like says my name and I'm like, fine, let me just clear this up. But most of the time, just let it go. So it's not true. High cholesterol is not normal. It's not healthy. Even the guy who wrote the carnivore diet, the MD that wrote the carnivore diet book, that was the New York Times bestseller guy, he stopped the carnivore diet and now eats plants again. Why? Because his cholesterol was so high, he was scared for his life. So it's just not, it's not true. It's not real, but you might have to let go of correcting everyone. It's going to take up all your time. You got to speak to the people who are ready to hear it. All of us need to do that. We have to focus our energy on the people who are ready to change or open. All right. And let's see, Lucky Cat 170, flax or chia, seeds or oils, which one do your rapid recovery lupus nephritis patients have the most success in? The answer is yes. Meaning all of those things are helpful, but if someone's in kidney failure where they have to reduce their potassium intake, then flaxseed oil that's been filtered and chia seeds are the way to go, because flax is high potassium. For most people, it doesn't matter because your kidneys get rid of extra potassium you don't need that's in food. All right. Let me see here. Okay. All right. And let's see. Karen, I make organic cacao with dates and cashews, and it makes me cough. Many things make me cough. How can I find out what exactly causing my food sensitivities? Well, first of all, that's just a sugar and caffeine ride right there, because there is caffeine in cacao. So any of you who found you have trouble sleeping after you have some cacao in your chia pudding, that's the reason. Dates are just nature's candy, but not in a good way. So you're having a whole bunch of sugar and caffeine. Maybe that's the problem there. You're also getting cashews, which is raising your omega-6. So it's definitely not a dessert you want to add if you're trying to reverse disease. But if you're in maintenance and that's the worst you do, then that's better than most people. So maintenance mode, and that's your dessert, okay. But if you find that it's a cough that you think might be allergic or food sensitivity, then the best thing you can do is just test things. So it depends on how quickly you want to do it. You can just, let's say that recipe is the only thing that made you cough. You could try making the recipe without the dates and just have some cacao and cashews and see how you felt. You could do just cashews, see how you felt. You can do just dates, see how you felt, and see if you can elicit the symptom, right? But if you eat very simply and only test one thing at a time, so the easiest way to do it would be to eat the things you know don't irritate you, and then only test one thing at a time. And when you test it, give it a few days to test it and see if it triggers the issue. Okay, and then hi 987956. All right, I've been doing rapid recovery for 30 days, but I feel worse. I haven't felt better. I'm not sure why. So again, you can't do rapid recovery without me. And for 30 days, I have not been doing rapid recovery because I've been actually traveling with my family. We went to Tokyo. I'll tell you all about it another time. But if you are trying to do the Goodbye Autoimmune protocol on your own and you haven't had any breakthrough in 30 days, it's time to get some help. But I would first look and see, have I had any breakthrough? Because the number one thing I see is that people have had breakthroughs, but they're ignoring them because the main issue they have isn't getting better. So I just did a video about not jinxing things where I talked about this a bit. I posted it this week where someone's going, I'm doing the Goodbye Autoimmune protocol because I want to get rid of my pain in my hands. And so every day they go, still have pain in my hands, still have pain in my hands, still have pain in my hands. And then they can say, see, it's not working. But then if I make them go a full diagnostic head to toe, oftentimes they'll go, well, actually, I haven't been needing my reading glasses, which is weird. And I used to have pain in my ankles and that's gone. The swelling in my knees is completely gone. I'm actually able to get my rings on again. So that means the swelling is down. And so I would first actually check in with yourself and see, has there been any changes head to toe? Energy, inflammation, pain, anything that's gotten better? Because sometimes the things that get better first just aren't the things you're focused on and you didn't even realize it. So if anything is better, then keep going. That just means that your body's healing other things first. Sometimes kidney function goes up first and people don't even know it until you get a repeat lab. Body usually likes to work on the organs first. So first check in on that. If you do have improvements, they're just not the thing that you wanted, keep going. You're doing it, you're doing fine, keep going. But if you do a head to toe scan and you're not feeling any change, something's wrong. So either you're doing something wrong in the protocol or you have other stuff going on, like your stress. Are you getting enough sleep? Because your body repairs itself when you're sleeping. Do we need to work on your sleep? And if you need help figuring that out, let's book something. You can book something with Thomas or me, or the fastest way to get my help was Rapid Recovery in August. But you can't put these ingredients into your body and not have your body use them. That's what's wonderful, is when you're looking at hardcore science, you put vitamins, minerals, antioxidants, omega-3 fatty acids. When you put that into the body, your body uses those ingredients. What does it use it for? Cellular repair, cellular function, getting rid of inflammation. That's a biology. It has to happen. It's just, where is it happening? And is it that whatever you're doing is just not sufficient to overcome maybe the stuff that's making you sick, like stress, sleep, depression, other things. So I can't tell you which issue it is because I don't know you and I don't know exactly what you've been doing. I don't know if you're doing it right. I don't know the other stuff going on in your life. But feel reassured that whatever ingredients you're adding is making you better. And then try to do that full diagnostic on yourself, and let's see if you can figure out what's going on and what needs to be fixed, or whether it's actually working. It just needs to be a bit more time. All right, let's see here. All right. Let's see. All right, I already answered that one. Sometimes people will write their question multiple times. All right, I'm ready to, I have Discoid lupus, and I feel whenever there's swelling behind my ears, I feel it's a flare-up. Are the two related? Good chance there is. I mean, if you're having swelling behind your ears and your rash is worse at the same time, I would say that that is a flare-up. So it may be related. Definitely do my full protocol so you can get yourself well again. Very important. Jay Carpenter says I should celebrate 20 years lupus free by traveling the world for a year. Oh my goodness. That would be amazing. I guess I could do rapid recovery from other countries. I think we're going to have to pause traveling the world while we still have a kid in high school though. But maybe one day, that would be pretty cool. I like it. Let's see. Okay, let's see. All right, let's go back to the YouTube side of things. I see Sean Williams saying, hey, Dr. Golden, I feel great. I think I might just stay raw vegan. A lot of people do that. People think it's so difficult to start the journey, but once you've been doing it long enough, it actually feels pretty amazing. So that's pretty awesome. All right, let's see here. All right, I don't see the question this came from yet, but I do see the answer. So Mary Styburn's answering Wendy. So I'm going to look for Wendy's question, but it says, in case she doesn't have time to answer this, I wanted to share that I went on the Goodbye Autoimmune protocol and the severe asthma I'd been experiencing went away immediately. I mean, I'd been in the ER 3 times in the past year with asthma. I was on a steroid inhaler just days before starting. FYI, I was on a low-fat, whole food, plant-based diet for years, 35 years vegan, but the Goodbye Autoimmune protocol is what made all the difference. And I wanted to show it, but it's like my whole face is eaten up by this one. But it is really, really beneficial for folks with lung inflammation. So I recommend that if you have lung inflammation, that you do this. One of the many ways it happens is, one, we're bringing down inflammation really quickly from omega-3 fatty acids, but also cruciferous vegetables themselves have been shown to directly decrease inflammation within the lungs, but they have to be raw, because one of the key ingredients that does it, sulforaphane, is destroyed by cooking. So it is really, really effective for things like inflammatory lung issues. So in case I haven't, so I'm guessing that's what Wendy was asking about. So I'm glad. Thank you so much for sharing that. I appreciate when you guys share with each other that way. All right. Let me see. All right, Crazy Farm Girl. How often does Hashimoto's heal enough to get off levothyroxine, or do most have to stay on it? I've been on it for 20 years at this point. I can't give you a number. I just don't have that kind of data just sitting there to be able to give you a number. What I can say is with Hashimoto's, the key to it, Hashimoto's is an autoimmune disease that attacks your thyroid. So what we want to do is we want to get rid of the antibody. And once the antibody's gone, then your body can work on repair. And so while many folks, especially in rapid recovery, find that they can immediately lower their medications, often in my rapid recovery group, usually within the first 3 weeks, people start getting symptomatic. Most folks with Hashimoto's actually start getting symptomatic of hyperthyroid because they are because they're suddenly getting more thyroid hormone than they're used to because the thyroid's working better. So that's really cool, right? But with there are others where they don't have that right away and they're still taking their medication. We're just watching the antibodies come down, right? So all you can do is get rid of the underlying autoimmune disease. So that's really important. And then we'll see what comes back. So if you find that you're getting jittery and sweaty and anxious, that usually means it's time to lower your medicine. So if the best you can do is get rid of the disease and you still need to take your thyroid hormone, it's still wonderful because you don't have autoimmune disease anymore. But most folks I find are able to lower it a bit, and some get off of it completely. It just depends on how much thyroid is left, how effective your body was at getting rid of your thyroid while the autoimmune disease was still active. So unfortunately, we just don't know until you do it. All right, I just saw the time and I still have more patients to see today. So I really enjoyed being back with you all today. Make sure that you spread the word on Men's Health Awareness Month. It is very important that you do that. And in the meantime, I'm still putting out information every single day. So whether you're on YouTube or Facebook or Instagram, I'm always out there putting the information out here. I will be back live again next week to do some more teaching and Q&A. And in the meantime, again, also, if you do plan to join my rapid recovery group, don't wait too long because it's filling up. So that's at goodbyelupus.com. You can check that out, or you can check the links in this video here. But for all the rest of you working on your own, keep going in all the different ways. Mental health, physical health, all of those are important. So the nutrition, your sleep, your self-care, and don't forget to have fun. It's the summertime. Go out there and enjoy yourself, because what's the point of working on your health if you're not going to enjoy your life, right? All right, everybody. I will see you next week live. I hope you have a great rest of your week.